Well, welcome everybody to the June online program for the alumni of the Sunshine Coast Health Center up here on the Sunshine Coast of British Columbia in Powell River. And June's program, we're going to talk about what we call co-occurring disorders. Basically what that means is there's the addiction and then there's some other disorder. And whatever that some other disorder is comes from this book. Honking great huge book here called the DSM-4. It's a Diagnostic and Statistical Manual of Mental Disorders, 4th edition. And the TR, it's got a DSM-4 TR. The TR is text revision, if you want to know. Anyway, they're going to come out with the DSM-5 pretty soon, but this is the Bible. It comes from the American Psychiatric Association. And so this is the one that Dr. Howard, our psychiatrist, will put down official diagnoses in this. So we got all sorts of things in here. We've got body dysmorphic disorder, or narcissistic personality disorder. You don't want that one. That's a really bad one. And a lot of addiction stuff too. At any rate, that's sort of the second disorder will come from that. That's why they're co-occurring disorders. Anyway, if you remember your time here, you probably remember handful of the fellows suffering from depression or anxiety or attention deficit, something like that. A lot of fellows have a real tough time sitting in the chair for like 10 minutes and stuff like that. That's the attention deficit. Anxiety, maybe some guys are just feeling really ramped up. So we've got some anxiety, that kind of thing, right? So as you know, here we deal with both of these things at the same time, right? Both of these things. So this month, we'll give you a little bit of insight into what they are, but more about how to deal with them. I mean, that's really what we're interested in. But as a starting point, it's important to understand what the disorder is and what we're doing with the addiction. So here we consider the addiction and the depression, attention deficit, or whatever it is, as a second disorder, and that these are different. Although we recognize there's an overlap, but we're different. A lot of people, a lot of experts in the field actually make the argument that that someone with an addiction problem, what they're actually doing is medicating this other disorder, like depression, anxiety, ADD, whatever. And that's an interesting concept, and it's really a source of controversy. So there are the group of people who say, look, they're just medicating their disorders, and a lot of people say, no, they aren't. They're using drugs the same way any addict uses drugs. And it's interesting when we talk to the fellows, right? Talk to fellows with trauma and stuff like that, and ask them, well, why do you use drugs? And they will tell us, well, because I'm bored, or I'm lonely, or something's going on for them that's they aren't comfortable in their own skin, and so they're using the substance to be able to exist comfortably, almost like to be themselves, right? But it's interesting when you talk to these fellows, because even if they're suffering from depression, anxiety, ADD, all that stuff, they keep talking about the same things. They keep talking about the loneliness, the boredom, the feeling that, life kind of sucks, actually, right? And it's not like they're telling us, oh, geez, I'm having such a traumatic memory episode. I just had to take a substance to solve it, to get rid of it. Yeah, that's usually not what's happening a lot of the times. But there are people who believe they are medicating. But there are an equal number of people who say, no, not really. They're just, if they have an addiction problem, they're just using drugs because their life doesn't have much meaning and purpose. And then there are people... and the trauma thing is sort of an added thing, or the depression is added onto it, or the anxiety is added onto it. And sometimes, in fact, it can all be wrapped up into one thing. One of the more obvious examples are alcoholics, that if you keep drinking a lot of alcohol, which is a chemical depressant, then at some point, odds are pretty good you're going to be chemically depressed. So you're going to suffer from depression. So that's another fairly common thing. But back to this idea of medication. So the research on the actual really scientific research on this is actually fairly weak, making the argument about self-medication. And apparently there's some big research study coming out of California, not yet published, but will be soon, which is going to claim it's going to go a long way to dismiss this idea that somehow people with the co-occurring disorder are medicating themselves. And as I pointed out in the online program, one of the things we know about alcohol, for example, which is fascinating, is that alcohol actually increases the stress response system in the body. And yet all these alcoholics are talking about, well, I got so stressed out at work, I just needed a couple of drinks. So what they're doing, they're saying, I'm so stressed out, gee, I think I'll take a substance that'll get me even more stressed out, at least biologically. Right? That's kind of interesting. Yeah, so I think I asked that question in the online program. How do you make sense of that? Because most alcoholics will tell you that they feel calmer, right? When they've just taken a substance in, which is actually going to crank up their stress levels. At any rate, the self-medication theory, I'm not a big fan of it myself. But it may be useful to know that Sunshine Coast Health Center, like a lot of experts, actually believe we're looking at two separate things. That there's the addiction part, and that there's sort of this mental health issue part, and that if we got to treat both together. And that's a good approach for recovery too, if you're suffering from one of these things, to actually think of them as, yes, there's overlap, no question about it, but actually they're two different things that we have to pay attention to. So we've got to pay attention to the recovery part, and we've got to pay attention to the depression or the ADD or whatever. And of course, as you know, if you take substances that aren't prescribed, you're going to screw up the other part pretty royally anyways, right? Anyway, that's our introduction. So we'll be back next week, and we'll get hints on some more of how to deal with these co-occurring disorders. Anyway, see you then.